Cardiopulmonary resuscitation, CPR, is a life-saving procedure used in emergency situations to revive a person who is not breathing and whose heart has stopped beating. It involves a combination of chest compressions and rescue breaths to maintain blood flow and oxygenation. Here's a general overview of the CPR procedure. Assess the situation. Check the surroundings for safety and assess the person's responsiveness by tapping their shoulder and shouting loudly, "Are you okay?" If there is no response, it indicates a medical emergency. Call for help. If you're alone, call for emergency medical assistance, 108, immediately. If someone else is present, have them make the call while you start CPR. Check for breathing. Tilt the person's head back slightly and check for normal breathing. Look for chest rise and fall, listen for breath sounds, and feel for exhaled air on your cheek. If the person is not breathing or is only gasping, they need CPR. Begin chest compressions. Place the heel of one hand on the center of the person's chest, just below the nipple line. Place the other hand on top of the first hand and interlock your fingers. Keep your elbows straight and position your shoulders directly over your hands. Push hard and fast at a rate of about 100,120 compressions per minute. Compress the chest at least 2 inches, 5 centimeters, deep for adults and adolescents, and about 1.5 inches, 4 centimeters, deep for infants and children. Give rescue breaths. After 30 compressions, give 2 rescue breaths. Tilt the person's head back slightly, pinch their nose shut, and cover their mouth with yours to create an airtight seal. Give a breath that causes the chest to rise visibly, and repeat for the second breath. Continue CPR. Alternate between 30 chest compressions and 2 rescue breaths. Continue this cycle until emergency medical personnel arrive and take over. You are too exhausted to continue. Remember, the earlier CPR is initiated, the better the chances of a successful outcome. Hands-only CPR, compressions without rescue breaths, can be performed by bystanders who are not comfortable giving breaths or in cases where the rescuer is untrained. These instructions are a general guideline for CPR. It's important to take a certified CPR course to learn the proper technique, as well as to stay up to date with any updates or changes in guidelines. Always follow the instructions of trained medical professionals and emergency responders in an actual emergency situation. CPR. Of course, here's a simplified step-by-step guide to performing CPR, cardiopulmonary resuscitation. Ensure safety. Make sure the environment is safe for both you and the victim. Check for any hazards before proceeding. Check responsiveness. Tap the victim and shout, "Are you okay?" If there is no response, the victim is unresponsive and you need to act quickly. Call for help. If you're alone, call for emergency medical help, 911 or your local emergency number. If someone else is around, ask them to call while you start CPR. Perform chest compressions. Place the heel of one hand on the center of the victim's chest, lower half of the breastbone. Place your other hand on top of the first hand, interlocking your fingers. Press down hard and fast, at a rate of 100,120 compressions per minute. Let the chest rise completely between compressions. Perform at least 2 inches, 5 centimeters, deep compressions for adults. Give rescue breaths. Tilt the victim's head back slightly, lift their chin, and pinch their nose shut. Give a breath that makes the chest rise. Repeat this step twice. Continue CPR. Alternate between 30 chest compressions and 2 rescue breaths. Keep up the cycles until help arrives or the victim starts breathing on their own. Remember, the main goal is to keep the blood circulating and provide some oxygen to the victim's body until professional medical help arrives. If you're not trained in CPR, you can perform hands-only CPR, chest compressions without rescue breaths, to the beat of the song, "Stayin' Alive," by the Bee Gees, which has the right rhythm for compressions. However, for comprehensive training and certification, it's highly recommended to take an official CPR course from a recognized organization. This training will provide you with the necessary skills and confidence to respond effectively in emergency situations.